Hello everyone, welcome to my channel. Today's topic is tympanic membrane perforation. Tympanic membrane perforation is from Medical Surgical Nursing ENT unit. Let's get started with the video. Tympanic membrane perforation is the rupture of tympanic membrane and perforation of tympanic membrane, which is characterized by discomfort in the ear and otalgia. Otalgia means pain in the ear, ache in the ear again. This is a diagram where there is a clear vision of rupture of the tympanic membrane. This whole part is tympanic membrane where there is a slight rupture. This is tympanic membrane perforation, which might create disturbance in hearing. Etiology can be, first of all, direct force and then indirect force and other causes. Direct force can be carelessness while removing wax. If we try to remove the wax with a sharp object carelessly. First of all, sharp object should not be used, and if it is used carelessly, then it can create perforation. Also, skull fracture. Because of skull fracture, if part of a bone comes in contact with the middle ear, tympanic membrane, then it might create perforation. Indirect force can be barotrauma. Barotrauma is injury or trauma to the ear because of change in air or water pressure. Also, indirect force can be violence. If any age group person, it might be a child or adult or old age, faces violence and trauma in the middle ear part, that might create perforation. Other causes can be foreign body, infection of the middle ear, trauma, eardrum trauma. Pathophysiology can be, first of all, etiological factors, because the etiological factors are different from each other's. Etiological factors like barotrauma, direct force, indirect force can cause a rupture of the eardrum. That rupture of the eardrum creates bleeding and inflammation, because of which symptoms like otalgia, fullness of ear, this can occur. Clinical manifestation can be, first of all, otalgia, ache in the ear, and then fullness of the ear, discomfort, blood things discharged from the ear, conductive hearing loss, vertigo, and tinnitus. Otalgia is earache. Fullness of the ear means feeling of fullness of the ear, feeling that something is filling the ear, which is not letting the sound to pass in properly. Discomfort, blood things discharges, blood containing discharge, conductive hearing loss is hearing loss created due to conduction of the sound. Vertigo. Vertigo is created when there is disturbance between connection of brain and ear. So disturbance in the ear-brain connection, disturbance creates disturbance in the perception. That brings the patient to vertigo. Patient is unable to move properly, unable to coordinate the movements properly. Tinnitus is stinging sensation or ringing sensation in the ear, inside the ear. Diagnostic test can be, first of all, history collection and hearing test. History collection because we need to know the chief complaint and if there is any history of previous ear infection. After that, we can perform orthoscope. We can use orthoscope to visualize internal organs of the ear. Tympanogram can be used to visualize every organ properly along with the site of bleeding. Audiometry test can be used if we want to test the sound capacity of the person. Audiometry test. If you want to manage medically, then antibiotics can be a priority, because if there is any perforation injury, there are chances that infection can be created quickly. So in order to prevent from complications, we need to provide antibiotics at the first stage. Amoxicillin 500 mg per 12-hour IV can be provided if the patient is admitted. If not admitted, oral form is available as well. Aseptic external auditory canal cleaning with alcohol can be done. Cleaning with alcohol helps to destroy all the pathogens present in the cavity. Nasal blow should be prohibited because forcefully blowing of the nose can create disturbance in auditory perception. Also, ear drops should be prohibited till the time treatment is going on, eardrop should be prohibited because there is an abnormal opening between middle ear and inner ear because of the perforation. So if the ear drops, you provide the patient for treatment of outer ear and middle ear that might enter to the inner ear and create some more abnormality, abnormalities which we don't want at this stage. Surgical management can also be done, that is tympanoplasty, repairing of tympanic membrane, myringoplasty, closure of the perforation. Also ossiculoplasty can be done, ossicular bone reconstruction, so that the further coming functions of the ear can be performed without any disturbance. Complications that can be created through perforated middle ear can be hearing loss, first of all. Chronic drainage can occur if it is untreated for a long time. Also cholesteatoma, again, fatty deposits can create a abnormal growth-like structure, that is cholesteatoma. That can be complications of this disease condition of tympanic membrane perforation. Thank you so much.